Hello, welcome to today's episode of the Aging with Ability podcast. I'm Christine. I'm the owner of Aging with Ability, and I'm a physical therapist. And today we're going to be talking about 11 conditions that you may be surprised that a physical therapist can treat. And this is mainly aimed at older adults since that's what I do, but it can be for anybody. So you can learn a little bit more about what we treat. So, the first condition I want to talk about today is a really big one that I don't think people know that a physical therapist can treat, and that is dizziness. So, a lot of times a patient will just kind of offhand mention to me that they're dizzy, or as we're assessing balance and they end up turning their head a few times, they can report some dizziness with that. But they may not necessarily know that I can help address the cause of that and figure out a treatment plan. So there is a condition called BPPV, and that has to do with the little crystals in your ear in the canaliths. And we can do a repositioning movement depending on some factors. There are a few contraindications to perform that movement, but it actually helps those crystals come back into place and can prevent dizziness. There was even a study showing that there was a 91% complete resolution of the BPPV symptoms at 3 and 7 days follow up from that treatment. So that's a huge percentage of success and something that's pretty easily done, but makes a big impact on someone's quality of life, their falls risk. And so, also following it up with some habituation exercises, or if BPPV is not the cause, there may be benefits to these vestibular exercises. And that's another thing that a physical therapist can assess for and use as a treatment option, along with habit changes, especially if BPPV is not the cause or the treatment is contraindicated due to some other medical conditions. Even changing, the way you move or the way you set things up in your home, things like that can make a big difference. But since dizziness does predate a lot of falls, it's nice to have someone who can assess whether that's the blood pressure change from standing up instead of, some other cause like BPPV. So that is number one. Number two is incontinence, and this has been getting a lot more attention. I've been seeing a lot more, articles and people that know that a physical therapist can help with this, but it's still just something to be reiterated. So this again is for men and women. Men have a pelvic floor too. That's just the muscles that support the organs of the pelvis, and plays a role with your, sexual and urinary systems as well. So pelvic floor therapy, general strengthening. There are therapists that are very highly trained in pelvic floor and can perform even like internal assessments to look for issues with contraction and things like that. And again, habit changes. Some people just rush to the bathroom often, and sometimes that can actually train your brain to need to go more frequently. And so that's a key component there that a physical therapist can really talk through with you and even have you fill out like a bladder journal and get to know a little bit more about that. So I even have a course that I'll put a link to in the comments or in the description about incontinence and kind of a little bit of a self-assessment and some ideas to get you started on treating that yourself at home. And then also some identifying features of someone who may benefit from in-person assessment as well. But you're going to leave that course knowing, whether you need that, and then a little bit more educated when you go into that visit with another provider in person. So number three, COPD, so chronic obstructive pulmonary disease. This is a combination of what we used to call like bronchitis and emphysema. They've kind of grouped it in to COPD. So there are respiratory therapists, but kind of physical therapists are in a good spot to be a little bit more frequent of a follow-up point. They're also more accessible than respiratory therapists. And we can teach you about breathing coaching, different ways to clear sputum, different ways to encourage a deeper breath rather than shallow breathing, especially with exertion. Monitoring vitals is really important, and that's something that, maybe a personal trainer or group fitness class is not going to be as adept at doing. And just seeing what your true response to exercise is. And then also improving your overall functional capacity so you can have a better quality of life. And another thing that I do a lot with my patients with COPD is work on disease education. So people don't truly know a lot of the mechanism of COPD, and they might not even know, a lot about their medication. So that's sometimes a learning opportunity, and I can help with that. And of course, other therapists can as well. And I am going to link an article below that talks about interval training. So that's just a type of exercise training that's shown to be really effective with COPD. And again, kind of having that one-on-one relationship with a therapist can really educate you and find your limits and, push those, of course, but also within reason. And again, that monitoring plays a role in that and how much you can really push forward and improve your health. All right, and number 4 is CHF, which is heart failure. And there are different types of heart failure. And that's, number 1 here is disease education. Again, just because sometimes you get handed that diagnosis, you get handed a medication prescription at those short doctor's visits that I talk about fairly frequently. I do believe that, my role as a physical therapist is educating patients, because sometimes those other providers don't have the 40 minutes or whatever I can spend with my patients to really go through their understanding. And I think that's a huge piece to people taking control of their own health and moving forward with a plan. And kind of like COPD, we're going to increase exercise tolerance, activity tolerance, work on quality of life. Also, edema management. I mean, swelling in the legs and ankles and feet is a huge part of heart failure just because of the way the heart is working. And so, talking about, whether compression stockings would be appropriate, that is usually up to a doctor to prescribe kind of the pressure, but a physical therapist can kind of assess for that and find out if that's appropriate, especially depending on tolerance for elevating your feet during the day or opportunity to do so, depending on your lifestyle. And then, just similar to COPD, monitoring vitals is another component of exercise program creation and things like that. And the 5th condition today is neuropathy. So, a physical therapist can work with you on desensitizing, working on some sensory training and improving your tolerance of touch on your feet, pain management as well, kind of monitoring effectiveness of medications, or making sure someone's kind of seeing if there's side effects that are impacting your life. I've worked with multiple people who have been in the process of starting gabapentin for neuropathy, and then, deciding with them whether those side effects are worth it at the time, or whether those things are going to improve once they've been on the medication for 4 to 6 weeks to really give it that chance to work. Um, and just like some of the other ones, disease education is a big part of that. What can you do? How can you make sure that you're staying as active as possible, even with this pain or numbness? Neuropathy plays a big role in falls because, of course, if you can't feel where you're stepping, you're losing a lot of that input that your brain uses to keep you upright. So, falls prevention resources, injury prevention, educating patients on looking at their feet frequently, making sure there's not an injury that they didn't notice, because wounds and wound care in neuropathy is a big issue as well. And then again, kind of modifying exercise for tolerance. If your feet hurt so badly, it's very difficult for you to bear weight, then are there ways that we can continue to strengthen in a seated position more until, things maybe change with other interventions? So those are the 5 I wanted to talk about today. I have 6 more in part 2. And then I just wanted to give a little bit of an idea about why physical therapists are in a good spot to treat these conditions. So you can kind of see how I talked about disease education in quite a few of these topics. Um, and that's really because physical therapists encourage habit changes. That's partly what our role is. And there's even kind of a push toward, modifying your lifestyle, implementing habit changes. And if you think about it, you think about if you work with a physical therapist, I see people usually 1 to 2 visits a week, typically 2 at the beginning of a plan of care, and then kind of decrease to once a week as able, or as the goals change or that person becomes more independent in their exercise program. So you think about 24 hours a day, 7 days a week versus that 2 hours a week, or, an hour and a half if they're 45 minutes each. What's going to make more of an impact on that condition? You're living with that 24 hours a day, every single day. And yes, a physical therapist coming in and, either doing manual work or modifying the exercise program, doing supervised activity, things like that are going to make a difference. And that's what we want to make a difference with our expertise. But every chronic condition, needs kind of daily care, and what you're going to be doing each day and how you can implement these habit changes to make the most out of your therapy sessions. And again, just every chronic condition benefits from exercise. There's not a single condition that you can't, look up a scholar article about how exercise of one type or another or every type can benefit that condition. And then just, we're in this unique role as physical therapists to be a movement expert. We learn all about the muscle system, all about the bones, full anatomy training and biomechanics for how people move and why, and what changes they make based on like an injury. You start to kind of limp on one side and then the other hip starts hurting, or things like that. Like, we kind of have that holistic view of how the body moves. But then also, manual therapy as appropriate, definitely being used less and less as we do shift our focus on, dependence on the therapist, where manual therapy was a huge emphasis in treatment plans, to now what can you do to help you get better as quickly as possible. And again, that quality of life emphasis. I mean, I love being able to go into a person's home because that does tell me a lot about them. Also, usually gives me an opportunity to include family members as appropriate, or caregivers that are there during that visit, and kind of see what's important to that person's life, and what activities they're doing. So, just really focusing on quality of life, that comparison of 2 hours a week versus every day, and how much you're doing to really buy into your plan of care, work towards your personalized goals, and make a difference. But you can seek a physical therapist about so many of these conditions, and some of them might have been a surprise to you. So if you feel like, this is helpful, or you found one of the conditions that I mentioned that you have and you'd like to learn about how you find your own physical therapist, you can definitely look at local clinics, kind of take a look at their website. Is there a specific, methodology they follow? Does it seem like they're really focused on individualized goals and what you're looking for? Do they mention your condition as kind of a specialty? You don't have to find a specialist in your condition. I mean, it is nice for some things, but it's also nice to have that conversation one-on-one, and you might not be able to find a specialist in your area. And if you have to drive an hour and a half to get to someone who's a specialist, you might not be as compliant with that plan than if you can find someone who knows a little bit about it but is a little bit closer, and you can really work on, researching that together and working with what they know about it, what you know about it, and making a plan together. And honestly, use your first visit to ask that therapist the questions you have. So, ask them, hey, have you worked with this condition before? I think that sometimes that gives my patients really good, kind of comfort that they're not the only ones that I've worked with the condition they have. And I can even provide, some insight with generic statements, obviously not giving any kind of patient information out, but oh yeah, and this has happened, or I've worked with at least 50 people with, post hip fracture or whatever it is, and can kind of give them a little bit of that reassurance. So really, when people ask me questions, that's important to me, because I know that they're trying to get to know me, they're trying to get to know how well we can work together. And then another thing is going into physical therapy with realistic expectations. You are going to have, homework, quote unquote, but it is about you, changing how you live your life in a positive way, and, some of the things that you can do. And that's important, because you live with your body every day. You live with these conditions you might be coming into therapy with every day. And what ways can you maximize how well you're doing overall? And again, coming back to the questions and how to just make your physical therapy a success is open communication. If the physical therapist says, hey, I want to see you 3 times a week for 4 weeks, and then we're going to do XYZ, and you just know that that's not going to work, you're going to start canceling visits or, whatever the case may be. Say, hey, this is my situation, etc. Like, I can only get here once a week. What can I do? Maybe there's a telehealth option for a second visit a week just to kind of check in, or maybe they can provide you with more resources to work on things at home and work towards your goals that way. So, very important to just, try to find a physical therapist that you can be comfortable with, personality, things like that, that are important when you form this kind of a partnership. And just really be willing to work with them and make sure that they know your goals, because that's important. If I say, hey, this person's going to get back to walking 500 feet in my notes, and you never planned on walking more than 20, and you want to just be able to get from, the bathroom to the bed, then those are going to be very different goals and different interventions. So please, just, if you need a physical therapist, find one, use your resources, ask questions. When you call the clinic, you can ask questions, or, at least at that first visit, kind of face to face is a nice way to do it as well. And just, go in with that mindset of, hey, we're going to set some goals. So I hope you learned something today, and I'll talk to you next time.